Hi, everybody. This is Pat Cook with the Colorado Gerontological Society, November the 21st. Happy Thanksgiving. I am making a short video drop for our YouTube channel. We will be sending out an email and social media. Please, you might need to watch it a couple of times. And then if anything else happens between now and Christmas, I'll do the same methodology and do a short drop and put it in YouTube and notify. And then January, towards the middle to the late part of January through probably April, we are going to have a lot of different areas in our industry impact us, and changes that are coming, things we're going to have to do, and more reporting that we're going to have to do than ever. And so I will we'll resume our ALR circle, our memory care circle, and possibly a behavioral health circle as things continue to evolve. All right, if you haven't watched the one that I just did recently, this is the jump on our YouTube channel, so you can go review that at your leisure. So what's going on? Why the the hassles, and why are we having to be hyper vigilant? So Australia and New Zealand gave us a heads up in July, when that's their winter months, that things were going to get wacky, and we didn't really pay enough attention as communities. I think the CDC and the WHO did, but we didn't take it seriously enough. And so they went through it already. It's called a triple-demic, and we are in it right now. So the three parts of this thing is, one, RSV. We are more familiar with RSV in our children, especially our little kids and newborns. And frequently newborns would get RSV within the first 3-4 weeks of life. We dealt a lot with that over the years, but RSV's changed. And now it's not only hitting the little kids, but it is picking on the seniors. And so we have quite a few people that have had RSV along with COVID, or RSV along with flu, or all three, depending if they got their 5th booster or not. So COVID continues to be a pain, and we're having outbreaks all over. Just a quick reminder that COVID, you are still really highly responsible for COVID outbreaks, and that you need to really pay attention to your community and how you're handling it. So one of the first signals that COVID is back in your facility is a loss of taste or smell. Okay, and then flu's here. And as I said in the video the other day, we've got several kinds of flu running around. And the one that mostly has me worried is the spring one, and that's the bird flu, or the avian flu. And that was the one that tortured me many years ago when I was actively practicing in the community. So these can come on, they can last. And we're seeing RSV lasting with really sick people up to 14, 15 days. Okay. So just a quick guide of what is the symptom and what do people experience. And so I put this on the slide to try to help you. But remember, all of them have a fever. So a fever is 2 degrees over the norm. So like for me personally, I run 96.9. So 99 would be a fever for me. If you're normally 98.7 or 99, 2 degrees over that would be a fever for you. So one of the things that we should have enough data, because we've been taking temps now for months, is knowing what people's norms are, okay? And then a dry to a wet cough, a lot of fatigue. Everybody I've talked to that suffered through this said they've never been so freaking tired as when they've had this triple run, okay? Runny noses and a lot of congestion. And the congestion, if it turns color like green, that is an infection, a mold infection that has to be treated on top of treating these three. So colored mucus is a whole different animal that has to be dealt with, and those folks are probably going to be in the hospital. All right, so right now there's a big campaign to test seniors for RSV. We've never done this actively that I'm aware of. We may have done some pilot or some study groups, but not as active as they want to do it right now. So they're testing for RSV, anybody that shows up in the ER or any of the urgent cares or any of the mobile urgent cares, trying to get an idea of the impact and what this is really looking like. I am not aware of any water studies that can detect RSV. I suspect they're out there. I'm just not aware of how they're being used, like in the COVID world. And then if you have an outbreak of RSV, there is a tool that you have to fill out. It's on the health department's website, and it's called Code Red, and it's for any one of these three or any combination of these three. If you are just wanting quick and dirty, everything that you've learned to do for the last year, the mitigation is going to be the same for RSV as you did COVID. We're back to full mask, eye protection, gowns, and gloves. Okay. So Friday, when I built these slides originally, there was 500 people, seniors, over 70 in the hospital, many of them in ICUs and step downs, and a lot of them had flu as well. And like I said, many of them have all three. So far, we've had no deaths of anybody over 70. Okay. So reminder, COFI and EMR are a responsibility at least twice a month. If you're not fully vaccinated, you're responsible for COFI on a weekly basis until you get 100% of your staff vaccinated for flu. Okay. So this is what I keep hearing. I don't want to do it, and a million and one excuses why not. There is some new information on the health department's website, how to disavow or take away all that misinformation that's out there. I would highly encourage you to look at it, because a lot of the rumors, a lot of the noise, and a lot of the other states that want the COVID epidemic to be over with, it's not only about the money and the impact on public health, it'll be about going out of control in the hospital world as well. If you have more than 12 employees, you can absorb one medical necessity vaccine waiver. You must get a new waiver. The old ones do not work. You must get a new one. Okay. They will wear eye protection, N95s that are fit tested, and gowns when they're in patient rooms or giving meds, and change gloves with every resident that they interface with. So they're going to look like robots, which is really going to hurt your image. If we have an outbreak, you're going to be also wearing masks. And so it's really important that, one, you understand your responsibility as an administrator owner of the reporting. And I get quite a few of you guys, when you do put the reporting in, I'm not getting those notices. So it concerns me that this is not getting done. Okay. You must update your vaccination plan. There's a new 2-page vaccination plan. And what I've been doing is copy and pasting from the old one, everything you can over, and then updating it and make sure that it's dated for November, okay? They will be asking for the vaccination plan to be faxed over to them if you have any outbreaks of any sort in any of the 3 issues, okay? I believe it's also on the EMR that you have a vaccination plan available for anybody that asks for it. Okay. All right. The other thing, and I've been talking to a few people, you must identify an infection control coordinator. They must take the class on, co-train, and then they need to get going and build a quality plan for what they're going to do to educate residents, families and friends, visiting staff, doctors' offices, dentists, all those folks that come in, and then regular visitors. So I've had quite a few one-on-one talks with the IC coordinators across the state, trying to help get some confidence. I would recommend that please take one of your better staff people on this. One, it gives them a chance to get an increase in recognition for their work and build skills in it, because this is not going to go away. We're going to have ICC a year round these days. And 2 is they get to build it and then educate and take credit for everything that they get done. So the ICC coordinator is going to be an important role in our industry. All right, so can my staff work sick? No. Do you need to hire some additional staff for on-call? More than likely, okay? Because you could have a surge. So we've had some facilities report that they had a RSV outbreak, and their staff didn't want to work because they didn't want to take it home to their kids. Remember, it's the other way around. Kids give it to the adults who give it to the seniors. So the staff need to take really good care of their kids. If they have an outbreak, they can return to work if they're vaccinated after they have 24 hours without a fever with no medications, okay? There is some antiviral meds available in the different public health departments, and they'll tell you whether they have it or not, or who the pharmacy is that has it. At the moment, from what I understand, there's no cost to Coloradoans through January the 11th. Okay. And then I'm going to say, go back to the old check-in. I think it's too risky not to check in staff on a daily basis. Make sure you have enough product and order additional product before the middle of next month, because you will be charged in the future for product. Okay. All right. So the seniors that got COVID 1 and 2 shots and Bellavent or bivalent in number 5 are doing really well. We're having very little outbreak. It's those that are not caught up and fully vaccinated. So right now, in the hospital world, what they reported Friday is 60% of the older adults showing up in ER, urgent care, and hospitals are positive for COVID. And the majority of them coming from the community, majority of them, like super majority of them, have had one shot. So in Colorado, we were pretty good at getting one shot in. It decreased significantly for shot 2, and every booster has gone down. The last I saw, we were only 18% vaccinated for bivalent. And we just can't deal with it in this industry, because it's going to kick your butt financially with fines coming from the health department, OSHA showing up and who's able to make fines, and then your insurance going up because you had outbreaks when you had the opportunity to prevent them. All right, so they reactivated the visitor sign-in. This is totally for contact tracing. So we're no longer doing PCR testing. We're only going to do rapids. And then they want to see who was in that room, which staff, what visitors, and do rapid testing on all of them to see what the storyline is going to look like. So go back, all visitors, have them check in, screen, make sure they're doing hand hygiene, preferably wash and isopropyl, not the wood grain alcohol that Walmart is selling. Okay, that stuff is poison. Use isopropyl 60%. No sick kids in the facility. And then if kids come in, preferably they wear a mask. You have to post if you're on outbreak status on your front door again. And then signage, go back to your visitor check-in signage that's available again on CDC and CDPHE's websites. Okay. So you have help out there. I'm glad to help talk you through. Your county health departments are doing great. And if you have an outbreak, you'll probably be talking to a girl named Megan, who seems to be handling most of the outbreak stuff down at the health department. So again, they're going to talk about contact tracing. They're going to talk about not taking a rapid the day of the outbreak, but the next day, and then 3 days later, and then 3 days later. And you have to have 2 negatives to be out of outbreak status. So I've talked to some facilities and they can't get out of outbreak because more and more people are breaking out. And so it's just rolling through their communities. The other thing, just if you are using agency staff, number 1, huge responsibilities in Chapter 7 of the documentation you have to have from the agency staff. Number 2, I highly encourage you not to use any agency staff that's on a waiver. Okay. It is, again, it's just too high a risk for you financially. Okay. So you got to go back to Chapter 7, do the list or look at what I put on the talk that I did the other day, and make sure that you have all the right documentation from an agency and an MOU, that they take full responsibility, that their staff has had all the training and they have it documented, and the competencies. You're paying a big bundle of money for them. It should not be on you to make sure that they've done the right thing. Okay. All right. As I said before, rapids will be the only testing we're doing. No PCR testing. Mako is no longer providing that for Colorado. Okay. So we're going back to isolation. So they prefer that you have a single room until your residents cleared. Not easy in my Medicaid market. So they'll eat in their rooms. They will be confined to their rooms until they have 48 hours without, or 24 hours without a fever, and 2 negative rapid testing 3 days apart. And then they'll wear a mask when they're outside their rooms. So it's really going to be a hassle. It's going to be really a challenge. any visitors, because Colorado passed that law that they can have visitors. And so, they have to wear a mask and they have to do social distancing. Okay. Please, guys, update your temperature equipment. Make sure you've got batteries. Make sure that it's being cleaned between residents, and make sure your blood pressure cuffs and your oxygen readers are being cleaned between residents. I would go back to reading everybody's temperature and everybody's oxygen level late afternoon, early evening, somewhere between 5 and 8 p.m. That's when we're seeing the most outbreaks. Okay. Hand wash, hand wash, hand wash, and get back to gloves, blue gloves, for taking care of residents in their room, black nitrous gloves for the kitchen. So this lady, she gave a really good talk the other day, and she's doing it worldwide. And this is her contact and where her information is on some talking to points to help you break through the barriers and the negativity that we're seeing out in the whole US, not just Colorado, but everywhere. So this website, what she has available, I thought could be very useful for training and talking points. All right, so last, I wanted to remind you that there is written and verbal information available at the health department. These are things that are new on the websites for the ones for training, information, following the data. Make sure that every Friday you're checking your county on the spinning wheel, not the community you want the transmission wheel, not the community level. So you're going to be on the wrong website. So make sure you've got that bookmarked. To me, it's like a spinning wheel that you would put a rodent on. Then get to your county. And if you're sustained or higher, you're really in shutdown. And even with high, you got to take really, really good caution. And I'm just going to say, I think we got through this the last time just by doing the right thing for the right reason at the right time. And my recommendation, let's just go back and let's do it. There's no rules that say you have to. You're doing it for the right reason. And again, if you're taking every precaution and try to do everything you can, then you've got 3 agencies that that will be coming at you, and they can make your life pretty miserable. So last but not least, thanks for paying attention to this. You may want to listen a couple of times or save the slides. I'll ask Lena to put them available to you again, like we have done our other slides. And if I have a great Thanksgiving, if I get to talk to you before the 17th of December, I will be here, and that's 855-293-6911. After the 17th, I'll be available by email. So thanks for coming today, and have a great rest of your week, and take good care of yourself and your family and your residents.